want to get to our guest, which is Doug McElway from the Fox News Channel, kind of playing off a little bit of what Donald Trump mentioned last night, replacing and repealing Obamacare. Doug, how are you?
I'm good, Mark. Thank you.
Good. So, we've heard from Paul Ryan and some other folks in Congress have kind of hinted that this may almost be more of an Obamacare reform than a repeal and replace. What are you hearing?
I think that's basically what we're evolving towards at this point. Certainly if you look at it in the context of a 30,000-foot view here and what has transpired over the last 7 years of Obamacare, recall that after it passed, without a single Republican vote back in March of 2010, the GOP basically made repeal of the Affordable Care Act a linchpin of their future hopes and their future power. They saw this, federally mandated program that covered literally 1/6 of the United States economy as a threat to Republican ideals, individual responsibility, to limited government. They saw it as a threat to the best healthcare system in the world. And then as it evolved and sort of manifested itself, we saw these rising premiums and deductibles that just fed the anger. It gave rise to the Tea Party, to some of those Republican victories in midterm elections, and arguably helped propel Donald Trump into the White House. But now that Republicans have power, the party that once confidently trashed Obamacare is kind of, to an extent, second-guessing itself. Repeal has evolved into repeal and replace. But we heard John Boehner speaking at a conference in Orlando last Thursday that even that might be a little bit disingenuous. He said, and I'm quoting now, "I shouldn't have called it repeal and replace because that's not what's going to happen. They're basically going to fix the flaws and put a more conservative box around it," end quote. So what was once a taboo in the GOP, Bible, government-run health care, appears to be here to stay, at least in part.
I'm just not sure Donald Trump lets them get away with that, though. Because here's my question, Doug, for you, because you've studied this so much. If repeal means drawing back these taxes, I heard one watchdog group looked at it and claimed repealing Obamacare would cost the U.S. government $300 billion in taxes. So that's what I see that as a positive. I know that they don't.
Right. There's another factor at work here that's sort of aside from the politics of it. And I spoke to Michael Tanner at the Cato Institute yesterday about this in a piece that's going to run tomorrow on Special Report. But he talks about this factor that sociologists and psychologists talk about something called the status quo bias, which basically says even if something is bad today, you fear that tomorrow and changing it could be worse. He said that's why people stay in a job that they don't like, rather than move to a new job. And that's what Republicans are facing right now. They're looking at it in a new light because they wield, power. Also, it is just a standard rule in Washington that it is toxic for any party in power to take away benefits that have already been provided. And so in the case of Obamacare, as much as you're talking about all of these middle-class Americans who are looking at these skyrocketing premiums and deductibles and are just outraged over it, Tanner makes the point that as angry as people are, and justifiably so, they have adapted to that over the past couple of years. But on the other hand, throwing 11 million newly insured off medical rolls basically gives Democrats, a public relations tsunami. We remember those advertisements of Paul Ryan lookalike throwing Granny off the cliff. They're gonna have millions and millions of variations of that. Just imagine all of the newly uninsured who are going to be in front of TV cameras and Democratic ads over the next couple of years. James Capretta from the American Enterprise Institute told me, and I'm quoting, "They got better coverage under this law than they had before. And for low-income people who had a hard time affording premiums in the pre-Obamacare world, they got pretty big subsidies." Now, having said all that, President Trump last night did indicate, to his credit and to the credit of the Republicans, that free market forces are going to play a big part in any repeal and replace bill. It's going to include the use of tax credits and expanded health savings accounts, giving more power and flexibility to the states to administer Medicaid. We're talking about increased competition, which allows Americans to buy insurance across state lines. So that's all change, and that's good change, and the kind of change that hopefully will reduce costs.
That's a good point. Doug McElway, we'll look forward to your report on the Fox News Channel. Thank you.
My pleasure. Thank
All right,
you.
take care of yourself. I appreciate you coming on. See, this is what I was afraid of. He's hearing this directly from some of these Republicans who are getting cold feet on repealing this monstrosity. We don't want the government in our health care. You know what? I'll even cede the point by the opponents that there are 11 million people who have health care who didn't have health care before. So what's that percentage? If there's 300 million people in the United States, that is a number we can deal with. Screwing up health care for everybody because of 11 million is throwing the baby out with the bathwater. I don't care if they scream and rant and rave all they want. We need to get rid of this thing and figure out a better system, a system that allows people to get health care who don't currently have it without screwing it up for everybody else. Ask the people who aren't the poor people, but who feel poor because their premiums went up $7,000 last year. Try to absorb that into your brain. I don't know how much money you make a year, but $7,000 a year is a big chunk out of my budget. For those of you who think that radio talk show hosts are rich, think again. $7,000 is a lot of money. If your car payment went up $7,000 in a year, what would you do? You'd probably quit driving it. But we're willing to let this thing continue? Forget repair. We need to repeal and replace, and you need to let your senators and your congressmen know that. That's what's got to happen here. This thing should never have been given birth to begin with, and we can't keep it just because of the excuse that it's bad politics when you give somebody something and then take it away again. That's what the Democrats were banking on, and the Republicans are playing right into their lap, I'm afraid. Rich, thank you for calling into the program.